the tiny voice of a new life coming into the world. The Medicana Advanced In Vitro Fertilization Center, answering the hopes and dreams of prospective parents. The Advanced In Vitro Fertilization Center at Medicana International Hospital in Istanbul operates a top-level, European standard fertility support program. The Medicana Advanced In Vitro Fertilization Center is staffed by highly skilled and internationally trained medical experts and is equipped with the latest cutting-edge technology. Advances in vitro fertilization techniques have made it possible for more and more couples to achieve their dream of conception. The Medicana In Vitro team of gynecologists, andrologists, embryologists, genetic experts, psychologists, biologists, and nurses are all standing by to bring the latest scientific methods to bear against the most difficult problems with conception. A couple that has been unable to conceive despite natural unprotected intercourse for a period of 1 year or more should schedule a medical examination with the Medicana In Vitro Center. Initially, the father is given a thorough physical and laboratory examination, at which point Medicana will begin creating a customized program of care and treatment for him. To determine problems related to the male, a sperm test is performed, in which the number, morphology, which is to say size and shape, and mobility of the sperm is examined. For the evaluation of the female, a hormone test and a comprehensive medical examination of the reproductive system, including the uterus, the ovaries, and the fallopian tubes, is performed. If blocked tubes or channels appears to be a possibility, the medical team may order a laparoscopy to determine the exact nature of the problem. In the IVF process, a small quantity of eggs released by the mother are removed from her body and delivered to the IVF laboratory. At this point, the mother's eggs are fertilized in the laboratory with the father's sperm. Then, the fertilized eggs are transferred back to the mother and implanted on her uterine wall. At that point, the process takes the same course as a normal pregnancy. Once the lab tests are completed and the Medicana team has given its recommendation to proceed with IVF, the couple is instructed to return on the second or third day of the mother's menstrual cycle whenever they choose to start the process. In this beginning stage, the Medicana IVF team carefully monitors the mother for 2 to 3 days with ultrasound and blood tests. The hormonal boosting procedure lasts approximately 8 to 10 days, at which point a final injection is performed to attain a maximum release of healthy eggs. Within 36 hours, the mother's eggs are collected under anesthesia immediately prior to their cracking. The father's sperm is collected on the same day the mother's eggs are retrieved. In some cases, the father is unable to provide a sperm specimen, or the density or morphology of the specimen provided are unsuitable for IVF. In such cases, an adequate specimen may instead be collected through a medical procedure known as micro-TESE. In the laboratory, the sperm and eggs are positioned adjacent to each other, permitting quasi-natural insemination of the mother's eggs. In addition, if required, the father's sperm can be directly injected into the eggs through microinjection. As a result, insemination and pregnancy can be attained even in cases of a very low sperm count. Over the next day, the fertilized eggs, known as oocytes, become embryos. These embryos are kept in the laboratory for 2 to 5 days to assess their health and quality. After this observation period, 1 or 2 of the healthiest embryos are implanted onto the lining of the uterine wall with the help of a thin catheter. Prior to the transfer back to the mother, the outer membrane of each embryo is removed with laser surgery, a procedure known as assisted hatching. Just 11 days later, the mother's ready for her first pregnancy test. In addition, with the permission of the couple, any remaining embryos can be cryogenically preserved. This will allow the prospective parents to proceed directly to the final step of implantation in case successful pregnancy and childbirth is not achieved from the first attempt. Medicana Advanced In Vitro Fertilization Center is dedicated to helping couples overcome difficulties in conception and achieving success in building their families. Our technology, training, and methods are world-class, and we pride ourselves on providing each couple with a package of services and procedures custom designed to their unique needs and requirements. Furthermore, infertility treatment at the Medicana IVF Center costs just 1/3 of the price in the United States and in many European countries. With no waiting list and the highest international standards of staff training, as well as cutting-edge reproductive medicine technology, the Medicana IVF Center is fast becoming the destination of choice for IVF patients from throughout Europe, the Middle East, and the Americas.
Tüp bebek tedavilerinde en önemli olan
The single most important issue in the treatment process is to accurately determine the specific medical problem the couple is facing. If the medical issue is well identified, one is then able to solve it through the use of modern technology and a highly dedicated team of professionals. This is exactly what we did with this couple. We showed them what the problem was, and upon providing an appropriate, effective, and economically sound solution, they were easily able to conceive. The reason for their prior failures was that the specific problem was not correctly identified. Once this was corrected, the solution was easy. We had not been able to succeed in numerous previous attempts with other physicians, but with Dr. Lachin, we were able to conceive on our very first try. We thank him from the bottom of our hearts. Modern medicine has nearly eliminated traditional infertility problems as a barrier to conception. The Advanced In Vitro Fertilization Center at Medicana International Hospital, Istanbul, with its staff of highly skilled and internationally trained medical experts and cutting-edge medical technology, is standing by to serve couples who still dream of parenthood.